Good afternoon to everyone on the line. Welcome to today's webinar presentation. My name is Maria Nuesi, and I will be your host and moderator. We are very excited to have all of you join us today for a brief presentation that will focus on how school districts can continue to support the emotional and wellness needs of their students amid budget cutbacks. Now, for those of you who are not familiar with Kognito, we are an organization that believes in the power of conversation and how conversations can have a positive impact on the social, emotional, and physical health of students and educators. And we harness that by creating virtual trainings that are grounded on providing individuals like teachers, students, and staff with the opportunity to practice conversation skills around tough topics like mental health, suicide prevention, trauma in a private and safe environment. Now, before I turn it over to our presenter, I'd like to go over a couple of housekeeping items. The first is that today's session is being recorded, so don't worry about taking any notes. We will send you a copy of both the recording and the slides after the presentation. The attendees will also be provided with access to the simulations that will be covered during today's webinar. The next item is that during the presentation, as an attendee, you are in listen-only mode. So please use the question box to submit questions throughout the presentation, as we have allotted time at the end to answer as many as possible. Finally, I'd like to open up a question to the audience, and if you could use the question or chat interface to share what are some of the challenges that you're currently facing that are related to funding mental health and emotional wellness resources in your district. If you could just share what are some of those challenges you're facing. Doesn't matter if they're very specific or broad, please share those in the question or the chat box, and I will circle back at the end to share some of the responses that we hear from you. Now, I would like to turn it over to our presenter. I am joined by Sabrina Johnson, who is the Strategic Account Manager for K-12 and is a passionate mental health advocate. Sabrina, will you take it away? Thank you.
Thank you so much for the introduction, Maria, and thanks everyone on the call for joining us this afternoon. I know that as essential employees, you are all working overtime to prioritize the emotional needs of your students and colleagues. So thank you for all that you're doing, and thank you for granting us 30 minutes of your afternoon today. The plan for this afternoon's presentation is going to be just to kind of start and evaluate where we're at right now. What is the need we're seeing in our school communities? What are the consequences of not meeting those needs? Then we'll look at how our simulations work and how they will benefit your school community as a mental health solution. Then once you're sold on our simulations, we'll go over how districts fund resources like Kognito while budgets are being slashed left and right, and share some real world examples of how people are getting creative these days. We'll go to the next slide. I don't think my controls are working. There we go, thank you. So just to open it up, Active Minds is a great nonprofit that works with high school and college age students. They raise mental health awareness through peer-to-peer interactions. So last month they did a survey of 225 high school students just regarding the impact of COVID-19 on their mental health. And as you'll see with those percentages and those results, sadly and unsurprisingly, students are really affected. I'm sure many of us feel the same way. 80% reported feeling stress or anxiety, another 76% feeling lonely and isolated, and about a quarter of them report that the most stressful thing has been just being really disconnected from friends or loved ones. This lack of connection is taking its toll on all of us, and it's critical that we both tend to our own mental health. Hopefully your peers and colleagues and administrators are telling you this, and to kind of think of it like the airplane mask metaphor, where you need to put your own mask on before you can help others. So I hope everyone is tending to their own mental health needs, so that you can stay attuned to the attitudes and behaviors that our students are expressing, so that we know how to recognize the warning signs of psychological distress. As trusted leaders in our school communities, the ability to lead conversations with students, to discuss concerns, build confidence, and increased connectedness is key, especially in this virtual or asynchronous learning environment. So, this has been a hot topic for, several years in the education space, and it's been getting more buzz in the last several months with COVID. I'm sure you're hearing a lot about trauma-informed teaching and ACEs, or adverse childhood experiences. So I won't, repeat everything you know, but very simply, ACEs are potentially traumatic events that occur before the age of 18. So we're talking things like experiencing violence or neglect, having a family member attempt or die by suicide, really anything that may undermine a child's sense of safety and stability. And they are very common. Sorry, next slide. So what is the impact of these ACEs? They significantly affect a child's developing brain and are also linked to chronic health problems, mental illness, and substance misuse in adulthood. And for the child's developing brain, we can see really immediate results of that: executive functioning issues, problems with concentration and attention, and also social and behavioral issues. However, they are preventable. So this is a great graphic from the CDC, really just showing a few strategies that we can employ to prevent ACEs. And what can we do? We can strengthen our support systems. We can promote healthy social norms. We can teach good skills such as social and emotional learning. And really key is the focus on early intervention. So being able to immediately recognize and address these traumas and behaviors. Ultimately, I think the reason that we talk about ACEs and trauma-informed practices is to raise awareness. The ultimate goal is to reduce stigma around seeking help and increase awareness of both healthful and helpful community solutions, so that we're promoting safe, stable, and nurturing environments for children. So if we think of these as the issues, these are issues, as long as children have been in schools, these are issues we're facing, and they're all just underscored during this moment in history. So how does Kognito work? How do we come in? Our simulations equip staff and educators to impact school climate across classrooms, cafeterias, playing fields, and even Zoom rooms and webinars like we're in now. So this here on your screen is our current catalog of PK-12 simulations. You'll see the variety of topics covered, from mental health and suicide prevention to anti-bullying, suicide postvention, and also some special topics for vulnerable populations such as LGBTQ and military children. Through our simulations, users will learn to use skills such as motivational interviewing, emotional regulation, empathy, and mindfulness to have dynamic conversations that foster relationships that support the whole child from preschool to graduation. And if we look at the next slide, we also have simulations that are geared towards students. So we like to think of a gold standard of Kognito implementation as having something for all adults at a school, staff and educators, to do on their end, and then pairing that with something for students. So the Friend-to-Friend SEL suite is geared towards students 8th grade and older. Currently, we have one product, Friend-to-Friend, for mental health and suicide prevention. Future additions to that suite, we have the substance use prevention for alcohol and other drugs that will be launching in February. And then school violence prevention will be launching a few months later, next fall. And just like, I'll circle back to the staff one. So whether the simulation is for students or staff, the interface is largely the same, and the additional supplementary resources are the same. So as a user, you're going to have a pre, post, and follow-up survey that helps us and you in turn, as the potential administrator, have some measurable metrics to kind of compare and see how your school community is responding. So we're able to accurately measure attitudinal and behavioral changes through our simulations. All of these also come with discussion guides, so you can even have a kind of blended learning model where everyone completes the simulation on their own time, and then you circle back up to work through that discussion guide together. And then for the student-facing suite, it also comes with a lesson plan, so you can make it a more all-encompassing experience for the students. So how do they actually work? We have the topics it covers. This right here is a nice little graphic about how it looks from our at-risk for middle school educator simulation. The functionality though is the same across the simulation. So prior to getting to this screen in the sim, you're going to have the coach. We have Coach Jackie for K-12, and she's going to lead you through a didactic portion to teach some of the basic skills that you'll use during the simulation. So that's going to be touching on things that I mentioned earlier, like motivational interviewing, asking open-ended questions, and also kind of giving some background. So, for the trauma one, she would give some background about ACEs scores and the impacts of those. You'll see above the student's head, she has a little thought bubble. The thought bubbles are great because you can click on them and just kind of see the internal dialogue. So we often wish in real life we could read people's minds, and our simulations allow you to do that. And along with those internal thoughts that are written out there when a thought bubble appears, the virtual humans are very responsive. So you'll be able to tell from their body language kind of how what you're saying is impacting them. Through the dialogue options, as the user, you're taking the role of this teacher speaking to the student. If I click talk and we were in the real simulation, there would be a few different options. I like to tell people when I'm explaining these that there's not really right or wrong answers. There are just more and less compassionate responses that you can choose. If you maybe make too many choices in a row that are not very compassionate, you will get a bit of a force undo. So the coaching feedback on the bottom is going to pop up and say, hey, you know what? She's not responding well to this. The conversation is not productive. Let's start over and kind of re-navigate a healthier way through this conversation. Before a coach feedback moment might happen, you also have the opportunity to undo your selections, which we also cannot do in real life. So as you're going through, I also tell people to just kind of do it all, or pick the selections that you wouldn't say in real life to kind of gauge the reactions, and then you can always undo it to to see each different reaction. Upon completing the simulation, you do receive a personalized performance summary. Again, it's not really pass or fail. Everyone will get through the conversation in a different way, and we are able to see completion data on the back end and through an admin portal that can help with any reporting and compliance needs that you have. So that is really just the overview of how it works, what topics we cover. But the reason why we're all really here is how do we pay for this? So to say this is a time of budgetary uncertainty is a gross understatement. And these past several months have witnessed a lot of Kognito partners getting creative with how they fund their access to our dynamic simulations. I think what it's important to know going into this is that our pricing operates on a public health model. So we're passing along economies of scale to our clients. As the user pool grows, the effective cost per user decreases. So having institutional unlimited access permit your school, your institution, maybe all schools in your district, all districts in your ESC or whatever kind of entity you may be, or all private schools in your private school charter system, to train any and all personnel for one annual cost based on teacher headcount. So we use that teacher headcount to figure out the cost, and then we say basically we're gonna double your access if we look at the math a bit simply and assume that there are twice as many staff members as there are teachers. So this means that we want the cafeteria workers, the crossing guards, the bus drivers, any adult at school who has an interaction with a child should be trained on Kognito, because we never know who a child is really going to latch on to. But this favorable pricing opens up more funding opportunities if you think about it as you really expand your scope. So looking at a few different categories of funding, I would say that federal funding is often a first round kind of investigations for our partners. We have a lot of our clients using Title IV ESSA dollars. SAMHSA's GLS and Project Aware grants are often used to fund Kognito. And the good thing to remember about federal opportunities is many of the grants are multi-year awards. So we're also able to work with a district or any kind of group for kind of a tiered implementation across multiple years to create a learning path that makes sense for you. And there can also be, additional discounts factored into, extending access for 2-3 years down the line. So we'll look at that a bit more. If we look more at state and local funding, according to the US DOE, it really is over 90% of funding for K-12 education that comes from non-federal sources. So thinking about things that are unique to your state and community. So, just thinking kind of off the top of my head, for New Jersey, we have the educational service agencies. We have county offices of education. We have Pennsylvania's intermediate units. Both New Jersey and Pennsylvania have school-based health centers. We see them get funding for neighboring districts. And also your state Department of Health and Human Services. These are all places that have different grants and award opportunities that we have seen real examples of them purchasing access. Here's another list. You'll get the slides after, so you can read through some of these. We have had some interesting and more unique kind of community, maybe a faith-based institution or various nonprofits, as big as Mental Health of America to as small as a tiny group in Alabama called Little Orange Fish that was able to fundraise and earn a lot of money to provide licenses of our at-risk simulation for local high school educators. So people really are quite creative and team up in really unique and exciting ways. So if we look at some real life examples, I'm going to start with someone who's kind of in our neck of the woods. We have Otsego County, New York. They utilize community funds. So this partnership was really an exercise in patience and collaboration. I'd say this was probably 8 months start to finish from trying to really figure out how to get the funding, how many communities and districts can we support with the funding. So they went in wanting to provide our at-risk suite and trauma-informed practices to at least 5 of their districts. So that was kind of our starting point. And due to various budgetary constraints, the Otsego County system of care wasn't able to pay everything out of pocket. So they kind of pivoted to Bassett Research Institute to kind of partner with them. And they said, okay, who else can we go to talk about funding? So we also turned to the BOCES and the Family Resource Network. The Family Resource Network was the ultimate buyer, and Bassett and the BOCES ended up being partners to also kind of help advocate. And again, the ultimate scope of this is access that touches on all 4 of those groups. So ultimately, the county was really successful, and they were able to provide our entire K-12 catalog, so that full screen of products you saw earlier, to 12 school districts and 8 additional sites. So this meant that all their Head Start centers could have our new early childhood simulation and some additional resource sites that don't have a lot of staff but definitely would benefit from a program like this. They were able to really figure that out. Another example we have is the Public Schools of Robeson County in North Carolina. So they received funds through the North Carolina School Safety Grant Program last year in late 2019. Oftentimes what we see is really one passionate employee who kind of takes the charge and is leading the charge with Kognito at the district and advocating and getting buy-in at the beginning part. So this behavioral health specialist had a goal to use the at-risk suite to meet a suicide prevention mandate. So she was able to use our evidence-based resources to make her case in the application and with her superintendent. So once she found the grant opportunity, she came to us and said, hey, I'm going to try to get this. Can you help me? And in those instances, we're able to turn around very quickly a formal proposal that can help bolster out your grant application, as well as formal published resources that demonstrate how these are all evidence-based and also have some real world successes that are published in a formal capacity to again just build that buy-in. And ultimately they rolled out a few months ago, and they were so successful that they have since mandated other Kognito simulations on additional topics, including trauma-informed practices and bullying prevention, and they engaged nearly all 1,500 staff members in a period of 2 months. So when we talk about how scalable and effective Kognito is, I think a statistic like that is really meaningful. There are very few trainings that I can think of where you could train that volume of people in that short of amount of time. Oftentimes we're seeing trainings that require you to sit somewhere for 8 hours, and having the funds and the time to have 1,500 people spend 8 hours anywhere is a real lift and a real strain. And fortunately with our simulations, you know, depending on how quickly you read, you're going to be sitting there for 45 minutes to an hour to work through this and still have a really engaging, effective experience. A third example that was federally funded was an ESC in Northeast Ohio. So they received funding in late 2019 through the Department of Education's Project Prevent. That grant addresses pervasive violence, trauma, anxiety, and other mental health needs among our youth. So this is a very big grant, and it's a 5-year grant. And you know, they had already gotten the money, and they had figured out how they were spending the money, and they booked a lot of in-person training. And then COVID happened, which meant that they needed a virtual training solution after canceling those in-person plans that they had. You know, we were able to come in, and we were in the unique position that we've always been virtual. You know, COVID didn't make us pivot to something virtual. So we're already there. The solution has been, you know, just as robust pre and post COVID. And they were able to supplement that in-person training with Kognito and train way more people than they had, you know, financially allotted for originally with their first round of plans. So far they've implemented trauma-informed practices for over 27 educators across the districts they support. And that's still, they're a really large ESC, and that's still a fraction of the people they support. So we're kind of using the goals and metrics that we set with them to kind of review everything at the end of 1 year of having access, and using that feedback and those results on seeing, you know, how and when we'll expand to all of the other districts that they support. So if we look at this slide right here, this is an example of the learning path. So once funding is secured, we can really work with your district to create an implementation plan that aligns with your own goals and mandates. A common implementation example would be a district that has a suicide prevention mandate. So they go ahead and they license our at-risk suite for year 1. So they're getting each grade level trained on mental health and suicide prevention. Everyone is trained in the first year. In year 2, they only train their new hires with the at-risk programs, and they introduce a new topic, perhaps trauma-informed practices, perhaps our postvention product, Resilient Together. And they're able to kind of grow on each, so that, you know, if it's every 3 years you need to be trained on at-risk, you're getting that mandate and then introducing new topics. Oftentimes that's based on the user feedback from the surveys that we collect. Same for the social emotional learning curriculum. So if we look at how the soon to be 3 products in the student facing suite can be paced out, we can easily, you know, launch one in the spring and then have, you know, the next fall and the following spring be again new content. We have districts implement at really any time of the year. I often like a mid-year, a spring implementation. So we're planning right now for some January launches, because for a 12-month licensing period, you're kind of getting 2 groups. So if you're paying for 12 months, but then in the fall, after you've already had access for 6 months, you get a bunch of new employees who started. They're still covered in that original contracting period. So it's a really effective system, and we're very flexible to work with your own scheduling and timeline of your own goals. So what are our educators actually saying? We have very happy users. I would say that the most common refrain is that Kognito is just far more engaging, and the skills are a lot more transferable to real life than many of the other training options out there. The simulations really do speak for themselves. So we'll be sharing a link to a full-length demo in our follow-up so that you can experience a Kognito simulation on your own and, make those kind of undue decisions yourself, and see how the feedback works and see how the whole functionality has an impact on you and your own learning style. But I will leave you with the words of this teacher who experienced a Kognito simulation for the first time during COVID-19. He says, "I think the skills in the simulation will help us as teachers have more engaging conversations and make more meaningful connections with our kids. It's so important for our kids to connect with us even in a virtual environment." I couldn't have said it better than myself, and I hope you all will enjoy the simulations when you get the demo, and I hope that you are able to consider some funding sources for us and for other vital resources for your school community. So thank you so much.
Thank you, Sabrina, for walking us through that and sharing some of the ways in which school districts can think about funding for resources in an environment currently where a lot of them are experiencing budget cuts. I have a couple of questions here, and again, I want to invite everybody on the line to submit any questions that they have about the content that has been shared. Sabrina, can you share for the student curriculum, what are some of the ways that districts incorporate that into the curriculum? Are there specific classes that are recommended, and are there additional materials that are provided to help incorporate that into the curriculum?
Yeah, absolutely. So what we provide totals about 300 minutes of classroom instruction. So that would include the time it takes for the student to do the simulation, and then the accompanying discussion guide and lesson plan. And the lesson plan is pretty adaptable, so you can make it work with your existing classroom plans. We often see this taught in a health class or something similar. I also spoke to someone recently, and they had implemented it in their English teachers were teaching with friend to friend, and they had incorporated some of their own unique writing assignments that kind of paired with the conversations they were having from the simulation.
Perfect. Thank you so much. So if there are no other specific questions beyond that, I want to thank all of the attendees for joining us today. As Sabrina mentioned, we are going to be sending the recording, the slides, and links to the simulations that we talked about today, which you will have the experience of trying for yourself, and we welcome your feedback. But otherwise, I want to wish everybody a great rest of your day, and enjoy the rest of your week. Thank you.
Thank you.